Thank you, Deputy Chairman, sir. I rise to support the Human Immunodeficiency Virus and Acquired Immunodeficiency Syndrome Prevention and Control Bill 2017. Sir, this is one of the very good bills drafted especially of the Health and Family Welfare Ministry. And last week when we passed the mental health care bill, this week we are passing the HIV and AIDS protection and Care 2017 bill. I think this shows the commitment of the government, and I would like to specially thank our Prime Minister Honorable Modi ji and our Health Minister Honorable Nadda ji for having taken this initiative of working and getting bills like mental illness bill, HIV and AIDS protection and control bill, because sir, these people, the people affected with these diseases are one of those who are isolated, ignored, neglected in the society and are not given the right they deserve as an individual, the human right that they deserve as an individual. So I would like to congratulate honorable ministers for having brought this bill. Sir, I would like to highlight why this bill is very important. My other colleagues who spoke before me have already said that India is third highest in the world in HIV incidence. I would like to also highlight some data here. In 2015, 2.1 million people were living with HIV, 0.3% adult HIV prevalence, 86,000 new HIV infections, 68,000 AIDS-related deaths, and 43% adult on antiretroviral treatment. Sir, the bill has very good provisions. First of all, I would like to highlight that when a person who's suffering with HIV is not given respect, and there is a social stigma with this disease, and that has been removed by this bill. This bill says there is a prohibition of discrimination of a person. Sir, we have seen in most of the workplaces earlier when somebody who's HIV infected was working, he was purposely for some or the other reason removed from that employment or from that job just because of the reason that he was HIV infected. Sir, also if we see children studying in schools, they are not treated equally like other children just because their parents or they are HIV infected. So this stigma, sir, that comes with the HIV and AIDS is being removed in this bill, and I would like to thank the Honorable Minister for taking this remarkable step as far as the HIV and HIV patients are concerned. Sir, this bill has very good provisions, like I said, for protection of discrimination. I would like to suggest the Honorable Minister, since I am myself a physician, and sir, I have seen when a patient who has already made his insurance policy, health policy, and later on if he gets HIV infected, sir, there is a clause in this insurance policies which excludes HIV. It says we will be giving insurance money to all patients excluding HIV. Sir, my request to Honorable Minister is that this clause, sir, should be removed, because that person who has made an education, health policy or life policy should not be discriminated, sir, on the basis of his HIV infection. So my suggestion is, sir, this should be given importance. Sir, secondly, if a couple is HIV infected and they, their health status is good, their CD4 count is good, they have not acquired any opportunistic infection and they are living a good life, sir, such couples should be given the right of adoption. Sir, this has not been covered under this bill, and I request the Honorable Minister that such couples, after doing their medical examination, should be given an opportunity of doing adoption, sir. Adoption rights should be given to such couples after doing their medical examination. Sir, another important issue that has been highlighted is that any HIV, any testing related to HIV would be done only on informed consent. Sir, this is very good step that the ministry has taken. And sir, also the bill says that in certain cases where consent is not required, sir, it says if there it's a court order, court says that HIV test needs to be done, no consent required. For if any part of the body, say blood or semen or any part of the human body of an HIV infected person is being used for therapy or for research, then consent is not required. Sir, I think this is a welcome step. Sir, in this, sir, I would like to request the Honorable Minister, all the points covered in the bill are very good. My suggestion on this is that, sir, in some conditions, in some medical conditions, when we admit a patient to a hospital, we don't do his HIV testing. But, sir, in cases where a patient is having fungal infection, like say PCP pneumonia, if a patient is having cryptococcal meningitis, such kind of infections which are not responding to treatment and we are suspecting that patient will have HIV, sir, in these cases also the HIV testing should be done irrespective of the consent. Because, sir, this is for life saving of that patient whom the physician is treating. So I think, sir, all these things should be taken into consideration. Sir, my colleague here mentioned about the medical establishments of the blood banks. Sir, I would request the Honorable Minister, sir, for screening purposes in licensed blood bank, we have made a provision that no consent is required. Sir, similarly, we should also have this law applicable to all the blood banks which are collecting blood under this law. Sir, we have seen that when a patient is going to some hospital and he is HIV positive, most of the times the private hospitals, they deny admitting that patient. They say we don't have ventilators, we don't have hemodialysis machines for these patients. Sir, my request to you is that it should be made mandatory to every hospital to have a ventilator and a hemodialysis where they have for other patients who are non-HIV infected, for them if they are having ventilators, then for HIV infected patients also they should have this facility. Otherwise, a patient is HIV infected and only on those grounds the patient is denied admission in that hospital should also be, sir, considered. Sir, my request to you is Government of India has taken up the test and treat policy. Under this, sir, we should also see to it that if a doctor or a staff who is working in hospital gets a prick of any patient who is not diagnosed HIV, but that person has got a prick, the medical professional has got a prick, sir, in those cases also the patient's HIV testing should be done. Because, sir, we have in the bill the post-exposure prophylaxis. If a doctor or a staff gets a needle prick of HIV infected patient, we give a post-exposure prophylaxis. But for patients who are not diagnosed HIV positive, sir, for them if a doctor or a staff or any healthcare provider gets a needle prick or gets injected by the needle, in such cases, sir, I think it is it should be made mandatory that that patient's test should be done, not only, sir, for the doctor or the staff, but if that patient is accidentally found HIV positive, it will be, sir, in his benefit also. His treatment will be started. We can save his life of the patient whose prick is been given. Sir, second, sir, I have seen in most of the tertiary healthcare government hospitals, outside these hospitals there are many private labs. Sir, these private labs, without taking consent, anybody takes the blood sample and they do HIV testing. Sir, this bill has made a very good provision that no HIV test shall be conducted or performed by any testing or diagnostic center or pathology lab or blood bank unless such center or laboratory or blood bank follows the guidelines. This is, sir, very important. Any lab, sir, very small lab established outside these big hospitals, they do these tests without taking the consent of the patient. So, sir, I think this is very important. Sir, today what is important in the country is educating the youth, educating the school-going children about these diseases. These diseases are not only infected by sexually transmission, but, sir, also IV drug abuse. So, sir, it is very important for us to include all this curriculum into the school syllabus also. Sir, my request to Honorable Minister is that about, sir, disclosure of HIV status. We have made a provision in the bill that doctors can disclose the HIV status to the partner in case if the HIV infected partner is not willing. Sir, this is a welcome step. Sir, I would like to, sir, just 5 minutes, sir.
No, Minister has to reply. 4 o'clock we are going to take Minister's reply.
Sir, in this, sir, about confidentiality of data. Sir, many a times what happens, we hold the hospital responsible for if the data is leaked. about any HIV infected person. Sir, my request is that instead of holding the hospital responsible, we should hold the person who has leaked the data. He should be held responsible, and sir, he should be punished. Sir, I have worked in a government hospital and I would like to share my experience here. In emergency, sir, when patients come, and I am a physician, so I would like to specially share this. We have treated a lot of HIV infected patients. Sir, when a patient comes to the emergency, a doctor's duty is to first save the life of the patient. Sir, many a times in government hospitals, gloves are not there. We are talking about universal precautions. Sir, if a patient is coming with, say, diarrhea, he is almost about to die if we don't treat him. So should the doctor wait for gloves to come, or should he go and treat the patient? So what is the priority? Should we follow the universal precautions? And sir, in that course, if the doctor or the staff gets infected with HIV, then who should be held responsible? Should it be the doctor who did not follow universal precaution, or should it be the medical establishment, the hospital, who has not provided the gloves? So sir, there are many cases where even doctors and the staffs have been infected with HIV in the course of saving the lives of the patients. So I think in such cases, compensation should be given to the doctor or the staff who has got infected with this. Sir, a very important point I would like to raise here is that, sir, we have post-exposure prophylaxis for doctors or nurses who have got pricked with HIV infected person. But sir, in sexual assault cases, like in rape cases, we don't give post-exposure prophylaxis to the affected girl or the affected female. Sir, this should be made mandatory, that if a rape case or a sexual assault case is first noticed and brought to the police station, sir, first thing we should do is we should give this post-exposure prophylaxis. Sir, my colleague was talking about CD4 count. Sir, I would like to mention here that CD4 count is important for giving ART treatment. But sir, these days I would like to specially mention here that viral load is more important while giving ART, because CD4 time, it takes time to drop. But viral load, it increases faster, and sir, we don't have adequate facilities for doing the viral load. Sir, in JJ Hospital in Bombay, which is, sir, a center of excellence for the state of Maharashtra, sir, all the complicated cases, they come to the JJ Hospital. I have worked in that hospital, and so I would like to specially give that example that, sir, when a patient who is HIV infected, complicated, comes to the center of excellence and we send the sample for viral load, sir, there are not adequate kits available for viral load. And sir, this is very important because early detection of treatment failure can be addressed at an earlier stage. So sir, my request to you is that this issue should be taken up with a priority.
Please,
sir, lastly, sir, just one point. Sir, lastly, I would like to mention here that pre-marriage counseling is very, very important, sir. And sir, in the bill we have mentioned HIV-related diseases, but sir, I think it should be health-related diseases, because not everybody will be ready for HIV-related pre-marriage counseling. So sir, health-related pre-marriage counseling should be done. Sir, with this, I support the bill.
Thank you.